In modern times, we cannot escape from innumerable negative environmental factors which influence our daily life in one or the other way. We are living in fast and highly competitive life and have to undergo various types of tensions every day. Dependence on medicines for quick relief is increasing day by day. Our luxurious lifestyle is completely devoid of natural way of living and labor which we otherwise get from daily physical activity. We Indians in the past had given a lot of importance to physical as well as mental exercise. In this context, yoga was part of our lifestyle. Due to the impact of Western lifestyle, people have forgotten our ancient values. Yoga is gaining popularity due to its immense benefits provided for all sorts of ills of the present society. Yogic practices can be adopted almost without the requirement of any equipment. Today, their efficiency is proven and hence popularity is increasing. Yoga is not just a regular exercise, it's a complete health science. Adoption of yogic way of life not only keeps us at bay from various diseases and disorders, but at the same time provides treatment also. Besides providing physical health, yoga contributes in equanimity of mind and spiritual development as well. In this film, all the 8 components of yoga, that is yam, niyam, asan, pranayam, pratyahar, dharana, dhyan, and samadhi are included in yoga therapy. The objective of this film is to create awareness among general public towards yoga as a way of life for healthy and peaceful living. Asanas and other techniques shown in the film should be done under the supervision of a qualified or trained yoga expert. 6 processes of Shatkarm shown in the film for purification of body are Dhoti, Basti, Neti, Noli, Tratak and Kapalbhati. Kunjal is part of Dhoti, and for doing Kunjal, one must sit in Kagasan and drink lukewarm water as much as possible. That is, up to throat approximately 1 to 2 liters. Get up with feet together, bent forward at 90-degree angle, and with the help of 3 fingers, tickle the base of the tongue till all the water gushes out. Kunjal cleanses the passage of throat up to stomach. It is beneficial for the treatment of diabetes, asthma, acidity, flatulence, indigestion and tonsillitis. It is also helpful in curing cough, constipation and foul odor of breath. For practicing Vastra Dhoti, take a 3-inch wide and 25 feet long muslin cloth band and soak it in lukewarm water. Hold one end and swallow the band through throat slowly in 10 minutes. When only about 1 foot of cloth remains outside, stand up and bend forward and do Noli exercise carefully. To draw out the swallowed cloth, pull it out slowly. Diseases like acidity, fever, cough, asthma, constipation and indigestion get eliminated. For practicing Jal Neti, take a specially designed vessel with long nozzle which can be inserted into the nostril. Fill it with lukewarm saline water. Sit in Kagasana and insert the nozzle in one of the nostrils. Bend the neck in opposite direction and let the water flow through the lower nostril. During the entire course of this operation, breathing should be done through mouth. Repeat the process with other nostril. For practicing Sutra Neti, take approximately a 2 feet long thick cotton cord. Twisted part of the cord should be soaked in pure wax to make it stiff. Insert the waxed portion of the string into the nostril and pull out the string from mouth. Neti purifies and tones up the nerves from throat up to head region and is beneficial in ear, nose and throat disorders. It enhances eyesight, hearing and smelling capacity. It is very useful in chronic headache, sinusitis, coughing, asthma and mumps. To remove the residual water present in the nose left after Jalaneti and Sutraneti, forceful repeated exhalation by moving the neck in all directions is done. It is known as Kapalbhati. This procedure purifies and tones up all the nerves of the head region and enhances working efficiency of brain cells. It is useful in running nose, coughing, etc. It enhances memory, intelligence and eyesight. After Jalaneti and Sutraneti, Kapalabhati should be practiced essentially. For practicing Nauli, stand with hands on knee, keeping both the legs nearly a foot apart. Exhale and drop the abdominal muscles so that abdomen muscles contracts inside. Rotate the Nauli for some time simultaneously by moving Nauli right and left, which is known as Vam, Dakshin and Madhya Nauli. It is beneficial in Vat, Pitta and cough disorders, improves digestion, relieves abdominal pain, strengthens and activates Saman and Apan Prana. It is useful in the treatment of constipation, asthma, flatulence and urinary disorders. Tratak, the last practice of Shat Karma, is done in many ways and the benefits are as many. Gaze given object without blinking by sitting in a comfortable position is called Tratak. The object for visual gaze may be a flame of earthen lamp, statue of deity, black or green spot or self-image in the mirror. Place the object at eye level, approximately 4.5 feet away. Gaze the object till the tears begin to flow. Close your eyes for a moment. Relax and repeat this exercise with wide open eyes. Regular practice of Tratak develops spiritual powers, improves concentration, increases willpower and sharpens intelligence. It enhances eyesight and eliminates ill will. Surya Namaskar. Surya Namaskar was much in vogue in India. Even those who are not familiar with the specialized aspects of yoga are conversant with Surya Namaskar to some extent at least. Surya Namaskar is an easy form of exercise which gives benefits of asana, pranayam and mudra. Practice of Surya Namaskar prepares the body for other yogic practices. It is best to perform Surya Namaskar at sunrise facing the rising sun. Nowadays, almost everybody is suffering from digestive disorders, directly or indirectly. It is the main cause of mental tension and worries. The intensively competitive lifestyle adds further tensions which affect mental equanimity. It disrupts digestive and other systems. Depression, anger, anxiety, frustration all emanate from tension. Surya Namaskar infuses happiness in the mind, which gives joy and sense of satisfaction. Surya Namaskar increases the oxygen intake capacity of the lungs. Chest size increases. Arms become strong and beautiful. Waist size decreases and thighs become strong. It is helpful in curing the skin diseases, constipation, and removes abdominal fat. It strengthens bones and joints. Pregnant ladies should not practice Surya Namaskar after 3 months of pregnancy. Surya Namaskar is not advisable for people suffering from hernia, hip pain, cervical spondylosis, heart diseases, and hypertension. Padmasana. Sit on the ground, stretching both the legs in front. Bend the right leg at knee and place the foot on left thigh. Fold the left leg and place on the right thigh. Place palm of left hand on the palm of right hand and position them near navel. As far as possible, keep the spine straight so that it remains erect. Close eyes gently and meditate. Padmasana is beneficial for the treatment of gout, sciatica, blood pressure, and heart diseases. It activates spinal nerves. It is very useful in meditation, prayers, pranayam, and awakening of Kundalini. Bhujanga Asana. Lie straight on your abdomen. Join legs, ankles, and feet with toes pointing backwards. Place palms flat on the floor below shoulders. Inhale and slowly raise the body and bend back way as far as possible so that it resembles the hood of a cobra. Body below navel should be on floor. Balance body weight on both the arms equally. Raise neck towards ceiling or sky. Hold this position. Do Kumbhaka, that is stop breathing or holding the breath, and exhale while coming down. It is also called Sarpasana. Bhujanga Asana eliminates constipation, indigestion, flatulence, and obesity. It is beneficial for the treatment of cervical spondylosis, slip disc, backache, diabetes, asthma, indigestion, tonsillitis, and menstrual disorders. People suffering from hernia should not practice this posture. Gomukhasana. In this asana, the position of legs looks similar to face of cow, hence called Gomukhasana. According to classical approach of this asana, fold the left leg and bring the foot under right hip so that the heel touches anus. Fold the right leg with left hand in such a way that both the knees come close, one above the other, and look like face of the cow. The right arm should be raised and bent at elbow behind the shoulder. The left arm should be bent upwards behind the back so that fingers of both hands are interlocked. Gomukhasana helps in spondylosis, piles, sciatica, asthma, and other lung disorders. It strengthens legs, knees, hip, arms, and shoulders. Halasana. Lie flat on the back with arms near waist and palms on floor. Raise legs slowly without bending knees till the angle becomes 90 degrees. Push the legs further over and above the head by raising hips so that toes touch the floor. In the final pose, arms should be straight on floor near waist or placed near head. It is called Halasana because the posture is similar to farmer's plow. Halasana makes the spine flexible and strengthens abdominal muscles. Its regular practice eliminates indigestion, constipation, gastric disorders, obesity, liver and spleen problems. It is useful in the treatment of diabetes and improves functioning of thyroid and parathyroid glands. Respiration becomes deep and long. Chakrasana. Lie flat on back. Bring both the legs up to hip so that feet touch the ground. Keep both legs nearly 12 inches apart. Bring hands backwards. Place palms by the side of the head below the shoulders. Raise hips gradually from the floor. Try to raise shoulder upside. Raise head also. In the end, repeat all acts in reverse sequence to come back to normal position. Regular practicing of Chakrasana prolongs youth and longevity. During Chakrasana, keep the body in semi-circle position. Practice of Chakrasana makes the spine flexible and strengthens nerves of the body. It reduces fat from abdomen and hips. Regulates blood supply to brain. Strengthen hands and legs. Helps in bringing the stretched navel in proper position. Patients of hypertension, heart diseases, lumbar spondylosis and ulcer should not practice this asana. Vajrasana. To practice Vajrasana, sit comfortably, keeping both the legs stretched in front. Bend the legs and place the feet under the hips. Keep the knees together and let both the hips fit in between the heels. Place the hand on thighs and keep the head, neck and trunk in straight position. Vajrasana is precursor to meditation. It is the only posture which can be practiced after meals. Regular practice of Vajrasana improves digestive capacity, provides relief in varicose veins, menstrual disorders, and other urogenital disorders. Specially used for meditation, it strengthens nerves and muscles of legs. It helps in digestion of food if practiced after meals for 5 to 10 minutes. Matsyasana. The posture floating in water on back without any effort is known as Matsyasana. To practice Matsyasana, sit in Padmasana. Lie on your back. Move the hands backwards over the head and raise the head with their help, and move the neck backwards so that top of the head touches the floor. Making hooks of the forefingers, hold the toes on the corresponding sides. Both knees should be touching the floor. Raise head, neck, body and back in bow shape, resting on hips. Matsyasana is also a complementary pose after Sarvangasana. Practice of this asana affects neck, heart, abdomen and spine. Enhances capacity of lungs, thyroid functions and purifies blood. It is beneficial in the treatment of asthma, gout, tonsillitis, diabetes, depression, anxiety and nervous weakness. Regulates menstrual cycle and beneficial in other menstrual disorders. It brings suppleness to the body. Ardha Matsyendrasana. Sit on the ground with both the legs stretched. Using the left hand, place the right leg near the left knee. Holding left toe with right hand, place the heel near the right hip. Keeping the knee backwards with back of the elbow of left hand, hold the right foot. At the same time, take right hand behind the back and slowly twist the trunk to the back as much as possible, as if looking backwards. The complete asana of Guru Matsyendranath being difficult, experts adopted only its half posture, hence called Ardha Matsyendrasana. Practice of this asana eliminates various types of spinal disorders, chronic digestive disorders and nervous weakness. It improves efficiency of liver, spleen and stomach. It is especially beneficial in digestive disorders and diabetes. Paschimottanasana. Sitting on ground, stretch your legs forward. Keep the legs together with toe close to each other. While inhaling, raise both hands over the head so that they touch the ears. Now exhale and bend forward, stretching the back, and try to hold the toes. Try also to rest the forehead on knees. Be cautious, knees should be kept straight. Regular practice of this asana enhances digestive capacity and makes spine flexible. It increases height and blood circulation of the body. It strengthens reproductive organs. It is effective in the treatment of obesity, skin diseases, constipation and diabetes. Persons suffering from neck and waist pain, abdominal pain and appendicitis should not practice this asana. Dhanurasana. Lie down on your abdomen. Let your head touch the ground. Bending the legs, bring the heels towards back. hold the ankle with both the hands. Raise the head, chest and thighs in such a way that the body looks like a bow and arms like strings. Note that the neck should be straight in Dhanurasana. The body forms a semicircular shape and the weight of the entire body rests on the navel. Practice of Dhanurasana reduces fat, broadens chest and decreases waistline, removes constipation and flatulence. It is beneficial in the treatment of cervical spondylosis, lower backache and displaced navel. Pavan Muktasana. Lying on the back, fold one leg and bring the knee near chest. Holding the knee with both the hands, release the breath and try to touch the chin or nose with the knee. Hold the other leg above the ground for some time. Come back to normal position and repeat the act with other leg. In the end, bend both the legs together and bring them to chest by putting hands around them and press the abdomen simultaneously, bringing your face near the knees. Practice of this asana removes stiffness of the spine and improves condition of each vertebra. If practiced regularly, it eliminates obesity, constipation and flatulence. Patients of cervical spondylosis and pregnant women after 3 months of pregnancy should not practice this asana. Yoga Mudra. Sit in Padmasana. Move both the hands backward and hold the right wrist with the left hand. Gradually bend forward and try to touch forehead and chin to the ground. Beginners should bend only as far as possible. This mudra of Yogasana is of prime importance for pushing prana upward through Sushumna Nadi. Regular practice of Yoga Mudra improves health of body organs below navel, tones up the working of urinary bladder, halts the enlargement of prostate gland, enhances digestive capacity and eliminates constipation. It infuses enthusiasm and joy in the mind. Sarvangasana. Lie down on your back with hands inside the waist and palms touching the floor. Raise the legs slowly, keeping the knees tight till the chin touches the chest. Support the body from hip with your hands. Resting on elbow, raise the body as much as possible and rest the entire body on shoulders. Stay in this posture for a while. Being beneficial for all the parts of the body, this asana is known as Sarvangasana. Sarvangasana purifies blood and is beneficial in eye disorders, stops graying and hair fall, eliminates menstrual disorders and enhances the thyroid functions. Sarvangasana should be followed by Shavasana. This asana should not be performed by patients of heart diseases, hypertension and cervical spondylosis. Shavasana. Yogic posture which brings complete physical and mental rest is called Shavasana. It is useful in all types of disorders, especially it reduces anxiety, stress and tension, at the same time improves mental alertness. Procedure is simple. Lie on a carpet on back. Keep both arms slightly apart from body, palms upside and legs apart. Close your eyes gently. Try to relax the whole body with auto-suggestions. Shavasana relieves physical, mental and emotional fatigue and mental imbalance. Regulates blood pressure, heartbeat, breathing rhythm and thus makes the mind happy and peaceful. Pranayam. Nadi Shodhan Pranayam is the base of all forms of pranayam. Sit in Padmasana. Close the right nostril with thumb of the right hand and inhale slowly in rhythm. Now close both the nostrils with thumb and fingers of right hand. Bring the hands in Anjali Mudra. Apply Jalandhar Bandh and Mool Bandh together. Hold the breath as long as comfortably possible in Kumbhak. Release Jalandhar Bandh and Mool Bandh while exhaling from the right nostril and slowly go in Uddiyan Bandh. Similarly, release Uddiyan Bandh and inhale slowly from right nostril till the abdomen is filled with fresh prana, and this stage is called Kumbhak. Again apply Jalandhar Bandh and Mool Bandh and hold them till you are comfortable. Practice of this pranayam purifies all the nerves of the body, opens blocked arteries, improves respiration, increases efficiency and capacity of lungs, eliminates lungs disorders, enhances concentration, relieves stress and tension. Bhastrika. The speedy rhythmic breathing with forceful inhalation and exhalation is known as Bhastrika. To do this pranayam, sit in Padmasana. Close right nostril and inhale from left nostril forcefully. Similarly, close the left nostril and inhale from the right nostril forcefully so that the abdomen expands till the abdomen is filled with air, and then exhale with force. While doing the Purna Bhastrika, inhale from the left nostril and exhale from the right, and again inhale from the right and exhale from the left nostril with forceful respiration. It is beneficial in Vata, Pitta and Kapha related disorders, purifies blood and improves blood circulation. It also purifies Surya Nadi, Chandra Nadi and Sushumna Nadi and regulates flow of prana. Patients of heart diseases and hypertension should not practice it. Thoughtless transcendental state of mind is meditation. It is believed that 7 chakras are present in our body: Mooladhara, Swadhisthana, Manipur, Anahat, Vishuddhi, Agya, Sahasrar. Meditation enhances power to concentrate, provides stability to mind, sharpens memory, reflexes and decision-making ability. It improves intelligence, willpower, and talent, relieves physical, mental, emotional imbalances, and provides enhanced coordination between the mind and the body. By meditating on all the chakras one by one, a true yogi acquires the state of self-realization, where there is no suffering of any kind, only happiness and bliss. The enlightened yogi becomes the master of divine powers.